Right, good morning everyone, and thank you for the introduction. Today I'm going to talk about three things that I've learned during the past 3 years of this pandemic. The first is that the world is going through some pretty rapid and profound changes. If we think of just 20 years ago, the city of Toronto was just coming out of an outbreak from a coronavirus the world had never seen before, and that was SARS-CoV-1. Fast forward to today, we're just coming out of a pandemic that has disrupted our lives for the last 3 years and caused by another coronavirus, SARS-CoV-2. So we can see that history is now literally repeating itself. And looking forward, we're not just going to be dealing with outbreaks that are explosive or pandemics. The landscape of diseases we already know about are shifting because of factors like climate change. So some of you may have read this week about people acquiring malaria in the United States. These are not travelers who went to a tropical region of the world and got malaria. These are folks that actually acquired it in the continental US. So what I'm here to say is that unfortunately this problem of infectious diseases, this is going to be with us for the foreseeable future. Now the second thing that I've learned is that when you are encountering an outbreak, and I'm an infectious disease physician doing this on the front lines, is that time is your most valuable resource. If we're going to get ahead of these outbreaks, we're going to have to detect them earlier wherever they might be in the world. We're going to have to anticipate where they're going next, and we're going to have to mobilize timely, coordinated responses if we're going to prevent or at least mitigate their impacts to our health, to our economy, to our very way of life. Now, the third thing I've learned here is that we are in a remarkable era of scientific and technological innovation. When I think of the work we were doing at BlueDot prior to the pandemic, using AI to detect the earliest signals of outbreaks around the world, I think that work was pretty remarkable, including detecting COVID-19 ahead of the WHO and the CDC. When I think of the work we're doing today, building upon large language models and how we're going to be able to leverage this to not only detect and understand the next outbreak even faster, but to be able to generate and disseminate actionable insights to audiences around the world, this is truly remarkable what will be possible. This is going to help governments better protect their people. This is going to help businesses better protect their people. It's also going to help businesses ensure that we have all the things that we need to control an outbreak, like vaccines, therapeutics, diagnostics, personal protective equipment, that those are all available in the right places at the right times. It's going to help healthcare providers like myself actually be more astute clinicians, and it's going to help global citizens and travelers protect themselves against dangerous diseases wherever they might be in the world. Now, I do realize that talking about outbreaks and pandemics, after 3 years of sheer exhaustion from COVID, this may not be the topic you want to hear about. I got to admit, I do this for a living. I'd also be happy to be talking about something else. But without being an alarmist, I want to say that the conditions that led to this pandemic, they haven't gone away, which means that we are going to be facing this challenge for the foreseeable future. But I also want to say we are in this remarkable moment of scientific and technological innovation, and advances in AI are really going to help us profoundly translate these innovations into real-world impacts that affect countless lives around the world. So with that, thank you very much.